Hello guys, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here to learn something new today. Today we will discuss about UB4 claim form in medical billing and from field location 1 to field location 7 information we will discuss today. This information generally known as a doctor information. Doctor is also known as a physician, is also known as a healthcare provider. See, guys, generally, after treatment is given to the patient, generally, these doctors or billing team or billing providers will submit the medical claims to the insurance companies and insurance so that insurance companies will review the medical claims, whatever the your healthcare doctor submitted to them. After review, they will adjudicate the claims, even they will process your claims toward the payments or denials. Generally, this process is known as a medical billing. So, in this medical billing, we will now discussing about UB4 claim form. So, here UB is stand for Uniform Billing. So, UB4 is also known as a 1450 CMS 1450 claim form. Here the CMS, we all of you know, right? It is abbreviated as a Centers for Medicare and Medicaid Services. The CMS 1450 claim form has 81 boxes, also known as a fields. This boxes is also known as a form locators, FL abbreviated, or field locators. Guys, this UB4 claim form is developed by the Centers for Medicare and Medicaid, nothing but developed by CMS, and also follow the CMS guidelines. And this UB4 claim form published by National Uniform Billing Committee, abbreviated as a NUBC, and also follow the NUBC guidelines. This UB4 claim form used by institutional providers. Since it is used by institutional providers, we can call it as a institutional billing. So UB4 is also called as a institutional billing form. And also this UB4 claim form used by facility providers. Some of the facilities using, some of the facility doctors using this UB4 claim form to submit their treatment to the insurances. So that is why this is also known as a facility billing or facility billing claim forms. And also hospitals generally for inpatient claim submission. So inpatient is nothing but whenever the patient is admitted in a hospital more than 24 hours, day and night included. It's nothing but more than 24 hours whenever the patient is admitted into a hospital is called as a inpatient. For that kind of inpatient submission, that might be, for example, inpatient might be for 1 week. For example, patient admitted to hospital for a week also. At the time, that kind of inpatient claim submission done by hospital providers to the insurance companies. So that is why we can call this UB4 claim form also as a hospital billing. So if anybody will ask you what is institutional billing, facility billing, hospital billing is nothing but UB4 claim form submission billing. And also I want to add one more important point. Generally, you have to understand that whenever you are submitting outpatient claims to insurance companies will process the claims and also they will give the payments to your healthcare providers based on predetermined or fixed provider fee schedule rates or charges. So for outpatient claim submissions, your doctor will get payment from insurance based on your provider fee schedule rate. But compared to and also coming to UB4 claim form, whenever you submitted inpatient claims, hospitalized inpatient claims to insurance companies will give the payments for your hospitalized inpatient claims based on your primary diagnosis code, whatever you build on a claim form. Nothing but based on DRG weightage. DRG is nothing but diagnosis related group. So whatever the primary diagnosis you build on a claim form, based on that primary diagnosis weightage, your doctor will get payment from the insurance companies for your inpatient claims billed. This is very important note point. You have to note it, this point. Okay guys, now we will discuss about field location 1 to 7. And before that, guys, if you are watching my video first time, if you're not yet subscribed, could you please subscribe our channel PKR Vibes Career and Growth, and hit the bell icon so that you will get every my video as a notifications to your mobile or desktop. Guys, now we are discussing about field location 1 on UB4 claim form or CMS 1450 claim form. Here, field location 1 is telling about the provider name and address. See here, healthcare professional doctor is also known as a physician, is also known as a provider. Here the terminology provider is nothing but a doctor, or nothing but physician. So provider is nothing but a person, or nothing but a doctor who is giving medical treatment to the patient, is nothing but provider. So in the field location 1, we have to enter the provider name along with the address, complete address. So here provider name and address can refer to, might be anything like clinics, medical groups or facilities. So if you are submitting a claim to insurance, the service is given in a facility, so that kind of medical claim you should have to submit to the insurance. So that should be nothing but you have to enter the name of that particular facility where the service is given. So that might be facility, or that might be clinic, or that might be hospital. So whatever it is, but you should have to enter the name of that particular facility. Example, it is a facility, you should have to enter the name of that particular facility in the box number 1, and also along with the complete address, and also you have to enter the complete address. Here I given one example. So here example is any hospital, like if for example there is a hospital name, you should have to give the hospital name and also address. For example, here I given 123 Annie Street. So like that, if you have any address of that particular hospital, you should have to enter the complete address here along with your zip code of that particular area. So for both inpatient outpatient claims, this provider name and address information is required. So guys, I given one note point. Mostly billing info auto populated from the claims management system. So generally what I'm telling is, if there is any information is stored in your management system of claims management system, while you are submitting a claim electronically, this information is automatically populated. But coming to paper claim submissions to the insurance companies, you should have to enter this information manually. So it's a depends on your claims management systems and the how you are submitting the claims to the insurance, like electronically, like paper. So this is what the note point I added here. This is about the field location 1. Okay guys, now we are discussing about field location 2 on UB4 claim form or CMS 1450 claim form. Here FL2, nothing but field location 2 is telling about pay to address and pay to name. We have to discuss here. Pay to address and what is the pay to name. So pay to address is nothing but whenever you submitted any medical claims to the insurance company will process the claim. For example, we can consider they process the claim and they paid the claim. So once they paid the claim, they should have to give the payment to the doctor on that particular claim. So they will give the payments to the doctor in the form of check, or in the form of EFT, or in the form of some other online way. But coming to the check, for example, claim is paid through check. They want to give the dollar amount to the doctor. They nothing but insurance is want to give the dollar amount to the doctor in the form of check. They will issue the check to the doctor to particular address. That address is known as a pay to address. So sometimes what happen, along with that check, they want to give the paid EOB to the doctor. Nothing but paid EOB is nothing but explanation of benefits or some other benefits, how much of amount they given to the doctor, and also what is the insurance allowed amount in that particular payment, and what is the patient responsibility in that particular payment, whatever insurance is allowed. So that kind of every explanation is given in a PDF format or in a paper format. That all paper related to the explanation of benefits, whatever insurance is provided to the doctor, should be given to this particular address. So they are telling that they are giving the payments through the check to this particular address. At the same time, they will give additional explanation of benefits and related documents to particular this mailing address. This is known as a pay to address. So generally we have to understand that pay to address is different from their billing provider's address. Billing address is nothing but whatever the information we are billing on behalf of doctors to the insurance companies. But coming to the pay to address is nothing but insurance companies are giving their benefits and their payments to the our doctors. So the address is totally different. Pay to address and billing address, you should have to understand. So here for both inpatient and outpatient claims required this information. This is what about the field location 2. Okay guys, now we are discussing about field location 3 on a UB4 claim form or CMS 1450 claim form. Here field location 3 is telling about there are two sub boxes like field location 3A and field location 3B. So coming to 3A is nothing but a patient control number, is nothing but a patient control number is nothing but a unique number or a designation that identify a patient's medical and billing records for a specific hospitalization. So this is unique, nothing but this is very this is changes from one patient to another patient. It is the not same for every patient. If patient is hospitalized, it is a one number. If you are giving this number uh, to the billing software, you will see complete patient information and what kind of treatment is given by the doctor to the patient, and what kind of patient documents, like what is the patient insurances, how many insurances patient have, and what is the patient address, what is the patient home address, and at the same time what is the patient basic demographic details, like what is the patient age, what is the patient gender, what is the patient phone number. This kind of all information you will see by this patient control number. So here the question is, who will issue the patient control number to the patient? Nothing but your billing doctor or your doctor will provide this number, patient control number, to the patient. So come, this is about 3A. In a box number 3A, we have to enter the patient control number, or we can see the patient control number in a box number 3A. Come to 3B, we can see the medical records number. This medical records number is nothing but MRN. Generally, we will call MRN. This is also unique number assigned to a patient in a electronic health record, EHR. It is known as a generally abbreviated. So this MRN is used to keep the track of medical history, diagnosis, treatments, and other important information which is related to patient care. So here the telling is, if you are giving this medical record, generally you will go for in depth of that treatment. So nothing but what the patient symptoms. For example, patient is going to the doctor. The patient symptom is very like related to is like illness. At the time you will give the symptom, right? That symptom, whatever the symptoms is giving, based on the symptom of that illness, what are the diagnosis codes are entered, taken, and after that, based on the diagnosis code, the doctor is giving treatment to the patient. What kind of CPT code billed to that patient, and that is related to the diagnosis code or not. Whatever the treatment is given, that is given by the doctor to the patient, the treatment is related to the illness or not. So that kind of every information. And what about the history? Nothing but the patient is like smoke, or patient is drinking, and how many times previously the same disease is taken by the patient. That kind of medical history will be given in this medical record numbers charts. So, and also important information which is related to the patient care. Nothing but patient is hospitalized whenever he coming to the hospital, or it is a emergency treatment, or it is like general treatment. So oxygen is used for the patient while you are hospitalized in a hospital for this kind of services or not. That kind of related information should be given on a format, PDF format, or on a paper. It is known as a medical record. At the time, you can see the doctor name and signature along with the time on that medical record at the downside of that medical record. So here what I'm telling is, just you have to enter the medical record number on a 3B of a field location 3B. So or otherwise you can see the medical record number on a 3B. This is about field location 3. This just you have to understand that in location FL3 you can see patient control number and also medical record number. This is about a field location 3. Okay guys, now we are discussing about field location 4 on UB4 claim form or CMS 1450 claim form. This is telling about the type of bill. Nothing but uh, type of bill is telling about what is the type of the facility we are using uh, for the claim submission. And for example, what kind of uh, type of care, like for example it is an inpatient or outpatient. So like that we can understand what kind of type of care also it is there. And also it is like frequency, like it is a like a corrected claim, or it is a duplicate claim, or it is a void claim. For example, I'm telling frequency. So that kind of everything we can understand based on this type of bill code. So this is very important for hospital billings, because based upon the type of bill code we can understand on which place the service is given to the patient by the doctor, and like what kind of patient it is like inpatient or outpatient, and how many times we billing this claim to patient. It is like a first time, or like original claim, or it is like a duplicate claim. I mean, in the sense it is a corrected claim, a repetitive claim, or it is a void claim, or it is nothing but replacement claim. Like that we can understand based on only type of bill whatever we bill to insurance. And also it will be changes depends on hospital, depends on ambulatory surgical center, depends on hospital. So it's nothing but it's a depends on type of facility. This code will be changes accordingly. So I will give some examples so that you will understand easily what is type of bill. Okay, I will give examples here, but before that, you have to understand that type of bill code is total 4 digits, but every first digit is zero starting with. So leave about and ignore that digit. Generally, after that, there are a 3 digits. Those 3 digits I will call like a 3 digits entire this type of bill code video. So the first letter is nothing but ignore zero. The first letter is nothing but after that zero there are a next letter is called I called as a first letter. So here I given one example type of bill 0111. Here the 3 digits is nothing but 111. The first letter of this 3 digits of 111, this is first letter is explained about the hospital. There are a type of bill code I am explaining now, 0111. That is nothing but hospital inpatient claim, where the first digit one is explaining about the type of the hospital. What is the type of the facility. Here what is the type of the facility is nothing but one. If there is a first digit is one, it is nothing but hospital. And the second digit here is 1. It is nothing but it is telling about the classification or type of the care. Here, if the type of the bill code second digit is a 1, it is nothing but it is a inpatient care. Nothing but it is a Medicare Part A. So here why I mentioned Medicare Part A. For example, it is a Medicare Part B. Here the code is changes. So instead of 1, it is we have to put like a 2 if it is a Medicare Part B. But it is a Medicare Part A hospitalized patient. Nothing but it is a inpatient of a Medicare Part A. Here the type of care is it is a inpatient care and Medicare Part A patient. So that is telling about 1. Second digit is a 1 of the code is nothing but it is a inpatient Medicare Part A. And coming to the last digit or third digit of a type of bill code 111 is, if there is a 1, it is admit through discharge. It is nothing but admit through discharge. So total here the code is hospital inpatient claim, is hospitalized inpatient claim, and is admit through discharge patient. That is the status, or that is nothing but here it is telling like frequency. He admitted and is discharged. That kind of type of bill code is given by the number 1. So total here example is 111 is nothing but hospital inpatient claim of a Medicare Part A. Okay guys, now we are discussing about type of bill 121. See here 121 is nothing but where one first digit 1 stands for type of facility. It is nothing but I already discussed, it is a 1 is nothing but hospital. And if there is a second digit is 2, the second digit of type of bill code is explaining about the type of care is nothing but what is the classification. Here the care type of care of second digit is inpatient care, but the type of bill code is second digit is 2, then it is a Medicare Part B. And if 1 is there for the last digit of type of bill code is nothing but admit through discharge frequency. So here hospital inpatient claim, but the thing is it is Medicare Part B. Here the type of care is changed compared to the previous one. So it's a 121 is nothing but hospital inpatient claim of Medicare Part B care. Okay, now we are discussing about type of bill 131. Guys, why I am discussing examples is by seeing example you can understand. Okay, this is the way how the type of bill code classification is there. So it is like understanding is easy if I'm explaining few examples. That's why I'm giving examples here. So here the type of bill code is 131 is nothing but hospital outpatient claim. So generally we discussed previously 111 type of bill and 121 type of bill. Here 111 121 both are inpatient claims. Here now we are discussing about outpatient claim 131. So how we are telling it is a inpatient or outpatient? See, by seeing type of code whatever you build you can understand and you can classify the type of care also, like it is inpatient or outpatient you can easily understand. Now see, there is where 131 code I am discussing now, where first digit is telling about type of facility. If 1 is there it is nothing but hospital. If the type of care or classification, the second digit if it is 3 of bill code, then it is nothing but outpatient. If there is a 1 it is a inpatient, it is 2 also inpatient, but if 1 is there second digit if it is 1, that is inpatient of Medicare Part A. If second digit is 2, that is nothing but inpatient of Medicare Part B. If the second digit is 3, is nothing but it is a outpatient. It is a outpatient. And last digit of 131 code 1 is telling about admit through discharge frequency. Okay guys, now we are discussing about type of bill 831. So this is totally different compared to whatever we discussed till now, the examples. It is about only hospital. It's first letter of the type of previous bill codes I explained is starting with 1. It's nothing but hospital. But here the type of bill code of 831, the first letter is starting with 8. 8 is nothing but ambulatory surgical center. So here facility is different. Facility is changed to hospital to ambulatory surgical center. So here the second digit 3. So since it is first digit is changes, the second digit also depends on a first digit. So here the second digit 3 is telling it's not like previously. It's in previous things there is a first digit 1. At the time the second digit might be if the second digit is 3 is nothing but outpatient. But here compared to here 831, first digit is 8, it's telling that ambulatory surgical center. The second digit 3 is telling about ambulatory surgical center services to the hospital patients. So that is the type of care, nothing but classification. So second digit, if it is 3 of a ambulatory surgical center facility, that 3 is telling about ambulatory surgical center services to hospital patients. So that last digit 1, it's same like admit through discharge frequency. Okay guys, now we are discussing about type of bill code 117. Here the first letter is here 117 is nothing but hospital inpatient replacement code or corrected claim. So here where the first letter is telling about facility type, 1 is there hospital, and here the second letter telling about the classification or type of care. Here the type of bill code is 117, nothing but second letter is 1 is telling about inpatient Medicare Part A. If the last letter is 7 or third digit is 7, nothing but corrected claim. That is the telling about the frequency, uh, that is the status of the claim, corrected claim. So here we all of you know, right, 117 is nothing but hospital inpatient corrected claim or replacement code. Generally corrected claim is nothing but a replacement of a prior claim. Okay guys, now we are discussing about type of bill. 138 is nothing but hospital outpatient void claim. So where the first digit 1 is telling about a facility type hospital, and the second digit here in this code 3 is telling about classification of a type of care is nothing but outpatient claim. If the last digit or third digit of the 138 code 8 is telling about void claim status. So here void claims is nothing but cancel of the prior claim. If you are doing the cancel of the prior claim, it is nothing but void claim. Okay guys, now we are discussing about field location 5 on UB4 claim form or CMS 1450 claim form. Here FL5 is telling about federal tax ID number. Here the tax ID number uses to track the money and identify the group with employees. So just this is a yeah, information is required for both inpatient and outpatient claims. And tax ID is a 9-digit number, and the tax ID format is 333 format. And this is just we have to understand in the box number 5 in the field location 5 we can see the tax ID. Guys, if you know the answer, just comment your answer. Here the question is who issue the tax ID, who issue the tax ID, which department is issue the tax ID. If you know the answer, comment your answer. Okay guys, now we are discussing about field location 6 and UB4 claim form or CMS 1450 claim form. It is telling about date of service. Generally we all of you know, right, whenever uh, on which date the doctor is giving treatment, I mean service to the patient, is known as a date of service in medical billing. So generally, we are discussing about hospitalization billing. Nothing but whenever patient is hospitalized, there is a date of service. Date of service will be like in a date range. So for example, 6 days the patient is hospitalized. We have to first day it's like starting the date of service start from first day to and end to fifth day. For example, last day service taken is like through date. So date of service through dates is nothing but starting date and last date, from this date through to the last of that date. So like that we have to enter the date of service range for the hospitalized patients or for inpatient claims for the field location 6. This is about field location 6 and nothing but date range. Generally it statement covers periods is nothing but date of service date range. Guys, field location 7 on UB4 or CMS 1450 claim form is nothing but just generally future use. It is a blank, it is a reserved for local use. So do not submit any information in this box, and also you do not see any kind of information if you are working for AR caller. You will be see like it's a reserved, it's a blank field location 7 box. Guys, if you felt content is useful, and could you please like our video so that it will reach us many more needy people, and who are looking for this content, it will reach us them. And really appreciate your time. Thank you so much for your time, and thank you for watching. Have a good health. Bye for now.